To understand how syringes can impact your business, it's important to understand the terminology used to describe syringes. In general, syringes have three parts. The first is the plunger, also called a piston. The plunger moves freely in the syringe and creates the vacuum to pull liquid into the syringe. Plungers in disposable syringes can be either all plastic or have a rubber tip. The part of the syringe within which the plunger moves is called a barrel. The barrel on common syringes is typically graduated, which means it's marked with accurate volumes for measurement. While most barrels are transparent to allow the user to see the liquid, there are some applications which will require an opaque barrel to prevent the user from seeing the material. This is sometimes requested for light-sensitive applications or clinical trials. The volume of the syringe is typically regulated by ISO, the International Organization for Standardization. Some syringes have graduations that extend beyond the ISO standard for that particular size. This is important to remember, as some people may refer to either measurement. In this example, the syringe may be referred to as a 10 ml or a 12 ml. Both are accurate descriptions of the syringe, but the volume standard is 10 ml. The third key component of a syringe is the tip. While there are many different tip types available, the most common are Luer lock, Luer slip, catheter, and oral. Luer tips, lock or slip, accept a needle and may be used for injections. As such, many hypodermic syringes are regulated by the FDA. The Luer lock tip engages the hub of the needle with a threaded locking mechanism. This is ideal for applications which produce a high amount of pressure or to provide an additional level of security to the user. Luer slip tips can be located in either the center of the syringe, known as centric, or off to one side of the syringe, which is called eccentric. Catheter tip syringes are the largest size common style tip design, used primarily for irrigation and similar applications. Oral dose syringes look similar to a Luer slip tip, but are oversized to prevent a needle from being attached. Oral dose syringes are commonly seen with oral medication, especially for pediatrics or animal medicine.